since the moment a tooth is removed from the patient's mouth, a process of bone loss starts. So patients start losing bone because the tooth is what is keeping that bone there. So patient loses a tooth, they start losing bone. So that's something that most people don't realize. So every time that patient gets a tooth out, start losing bone, reduce function, and reduce aesthetics, and with the replacement of the tooth with a dental implant especially, we are able to keep the bone in there, we're able to keep the function and keep the aesthetics, of course. Every time a patient loses a back tooth, there is biomechanics the way the mouth works, and there is more load applied to the other teeth. And that's something that most people don't realize. When you have missing one of the big molars on the back, there is a lot of overload, and there is a domino effect that starts happening. It doesn't happen overnight, but slowly start happening because now there is more load on the other teeth. So then another tooth cracks, and then the patient loses another tooth. And then, over a period of 10 years, people can end up losing most of their teeth because of this. So it's very important in the back to get a tooth replacement to help with biomechanics, the stability of the jaw, and in the front, just because of aesthetics as well and comfort, and also put a stop to that bone loss process.